So an important point is that people with brain disorders also have a personality. Personality develops before the brain disorder, and that personality comes from temperament, and it's often started before the brain illness and interacts with whatever diagnosis the person has. So I will try to move this. Okay, so personality starts, and then it interacts with the brain disorder. And then taking schizophrenia as a good example, just like in the general population, most individuals with schizophrenia are not violent. However, just like in the general population, a few individuals are simply more angry, aggressive, or impulsive than other people with schizophrenia, or most other people with schizophrenia. If you have an angry temperament, and you hear voices telling you to kill, and you perhaps are using drugs or you have weapons available, these confluence of events can escalate violent behavior. So there are disorders that are characterized by excessive anger to provocation in tandem with poor self-control. So being angry and aggressive is almost not enough for violence to erupt. There has to be poor self-control. And we know people around us that have poor self-control, that are more impulsive than other people. And people with this type of excessive reactive aggression, also known as intermittent explosive disorder, usually have other problems like depression or anxiety. However, a core problem is their angry and aggressive personality. So they're constitutionally primed to perceive threat where other people do not perceive threat, and to react by threatening or violent retaliation. So research in our laboratory shows that these individuals who have abnormally high anger and aggression traits also have excessive or more activity in their brain just during rest. They're not doing anything, they're not being provoked by anything, they're not being challenged. Perhaps they're daydreaming, but their brain, and you can see that in the red through positron emission tomography, the brain is overactive during rest. But what happens when the same individuals are doing an executive function task, a task that requires the prefrontal regions of the brain that have to do with executive functions? They have less activity during the performance of such a task. And so it appears that if you take all of this together, people with different personalities have different resting baseline response, so that when they're not doing anything, their baseline is preparing them to respond to when they have to do something. And that has to do with traits and personality traits. And that's in common with all different individuals, not just individuals with aggressive disorders. So differences in personality are also have to do with brain chemistry, not just brain function. This is an enzyme called monoamine oxidase A, and people who've done aggression research know a little bit about the monoamine oxidase A gene. Monoamine oxidase A is an enzyme that breaks down neurotransmitters that are very important, like serotonin, dopamine, norepinephrine. So it regulates monoamine in the body, but also in the brain. So when we scan aggressive individuals for their activity of monoamine oxidase in their brain, the activity of the enzyme, we see that they have less of this activity. So here in this panel on the left are aggressive individuals, and in the panel of the right is a control group, people who are the same age, same sex, but they're not as aggressive. They have more MAOA activity in their brain. And here in the level of the thalamus, you can see the red represents more activity, whereas the greenish-bluish represents less activity. So that's also an important point to make. Once you track personality, you can see the different neurobiological markers of that personality. But to sum it all up, really, and to make the point even more important, because what I showed you was a lot of different disparate data, and of course I didn't cover everything. If you want to really understand the severity of aggressive behavior, and if you graph it in terms of markers, okay, where the red arrow here points to escalation of aggression, you have to think about the lifespan, an individual's lifespan. And you have to think about all the different factors that come together that impact the escalation of violent behavior. So what do I mean by that? It starts, of course, with genetic endowment that you see here in the corner on the left side. But also, for example, exposure during pregnancy. So we now know that women who smoke during their pregnancy, the exposure of the smoking, not necessarily nicotine, but just the act of smoking, reduces the enzyme MAOA. So the reduction of the enzyme in the brain of the offspring has to do with the trajectory in which they grow and develop after they are born. So exposures start with genetic endowment, but also with the way parents are exposed to carcinogens and other effects. Of course, there's also altered monoamines that come from the smoking exposure or can come from genetic endowment. When you start going into, so that contributes to hyperactivity, emotional problems, sort of the seeds of possible aggressive behavior. And then when you reach adolescence, complexity definitely grows in a young person's life, and they have to deal with the social world, they have to deal with stress provocation, and they have to deal with smoking and alcohol and other drugs that affect their decision-making. And their decision-making affect also the degree to which they will engage in these behaviors, these risk behaviors. And then when you go up to adulthood, this continues to grow. All of these factors continue to add up and grow, and then you add to that some more stress provocation, inability to stop yourself when you really want to do certain things, and very high trait anger and low trait control. So we know all of these things, and there are many other factors that will come into the picture later on that we will know and we will be aware of. And so it's important to let go of the stigma and to let go of the way that we see black people or white people or Jews or Christians, religion, brain disorders, and start tracking personality. Of course, the work we do nowadays, the work we do is not the work of one person. It takes a village. Thank you.